Hello everyone, this is Dr. Demchenko, and today we will discuss scoliosis. Scoliosis is a huge topic and a very large number of people suffer from it. The thing is, it's not a single disease, but rather a group of symptoms that can manifest in different ways, and that's why we will see various kinds and types of scoliosis. I'm constantly being asked to straighten scoliosis with my hands, to fix it, to adjust the vertebrae in such a way as to remove the scoliotic deformity. And there are a huge number of such requests. People who come with children or already as adults and say that they need to have their scoliosis fixed. So, I would like to say a few words about the approaches to treating scoliosis and what it actually is. If a child starts to develop uneven shoulders at a young age and you notice that their back has become somewhat uneven, then it's possible that scoliosis is beginning to form. And to be precise, what they have is a scoliotic posture disorder. What does that mean? It means that the bones are still of normal shape, but it's just muscular tension or, for example, a difference in leg length or some other factors like improper sitting at a desk that start to form. He initially has such a muscular pattern, that is, there is this muscular tension, a muscle tension imbalance in the body, which will lead him to a postural disorder of the scoliotic type. I also wanted to say that we have two more types of posture disorders. These are hyperkyphosis, or slouching, and hyperlordosis, when the lower back is very strongly arched. And here are hyperlordosis and hyperkyphosis. They have nothing in common with scoliosis and are very easily corrected through exercises and even partially with manual therapy and osteopathy. Scoliosis, on the other hand, is a much more complex condition, and it is characterized specifically by the rotation of the vertebrae. That is, what we see is this kind of curve in the patient, and most often in children. Initially, scoliosis presents as a single C-shaped curve, which later in adulthood develops into an S shape with compensatory curves. Not with one, but with several curves. This is, first of all, not so much a deviation to the side, but rather a rotation of the vertebrae to one of the sides. And when scoliosis actually occurs, it is a change in the bone structure. That is, the vertebrae themselves have not only rotated, but have also become curved. They have experienced torsion. Many people confuse rotation and torsion. What is vertebral rotation? If you imagine that I am a vertebra, then I turn completely like this around my own axis, and this will be rotation. And accordingly, this rotation can last for a very long time. For example, I turned, stayed here, and my muscles keep pulling me further in this direction, but I have nowhere else to turn because I've already used up all my mobility. And that's when torsion begins. What is it? It's when rotation has already been used up. Since the vertebra is soft, the bone starts to deform, and the further rotation of the vertebra, like the bone itself, begins to happen because the bone itself starts to twist and deform like a screw. And when this twisting deformation of the bones happens, the ribs in the thoracic region of the spine also start to deform. And we see an element called a rib hump, which on one side is visible on the back when the patient bends forward, and on the other side in the front, it appears as a difference in the rib arches from the front. It will seem as if one side of the chest is larger and the other is smaller. Below, one rib aperture will be more open, while on the other side it will be less open. There will be a difference in the clavicles and very often a difference in the shoulder blades. And in childhood, when the spine still has rotation, there can also be rotation in the ribs. There is much you can improve here. First of all, with exercises, manual therapy, osteopathy, and massages to relax the spasmed muscles and sort of return the vertebrae to the correct rotation. But it is very important to always do stabilizing exercises that correct scoliosis, and not just any exercises, but specially selected ones. I'll talk about that a little later. In adulthood, when we already have vertebral torsion and rib arches, the actual formation of scoliosis occurs. And this is already a completed process, meaning the bones have hardened. You can still work with it, but the task of a manual therapist, a massage therapist, any osteopath, anyone who works with their hands, is not to correct scoliosis or fix the curve, because that's impossible to do since bone torsion has already occurred. We will actually work with such a patient as we would with a patient without scoliosis, and we will pursue the same goals. That is to improve mobility and reduce pain. So if a person with scoliosis comes to you, you will work on their pain and movement, not on their curve. Because it's impossible to do that in adults and even in children, scoliosis can't be treated with just massage and osteopathy. That's also the wrong approach, because we're only treating muscle tightness, which will just come back again. It's very important to analyze the difference in leg length, because a huge number of scoliosis cases are of the ascending type. So we have a difference in leg length, a pelvic tilt, and then a scoliotic curve develops. In this case, it's absolutely necessary to correct the difference in leg length. For children, this will be a compensatory heel lift that will stimulate the growth of the shorter leg. For adults, it's the use of a supportive heel lift. If you look at this image, it's a panoramic X-ray which is done to calculate exercises, determine the degree of scoliosis, and see the difference in leg length. We can see what type of scoliosis this person has. If the type of scoliosis is ascending, then the lumbar curve will be more pronounced. You will also see different positions of the pelvic bones in terms of height and a difference in leg length. In this case, to correct scoliosis, it is necessary to even out the leg length, align the position of the pelvis, and then proceed to correct the spine. For adults, it is mainly about reversing the rotation. The rotation of the vertebra is difficult to correct when the bone has already changed shape, as the internal rotation or torsion becomes nearly impossible to fix. With the help of exercises, you can make it so that the muscles hold the vertebrae in a more correct position. And visually, it will look about 1 degree of scoliosis better, and the person will feel better. But this is achieved only through exercises, not through manual therapy. Now, the internet and YouTube are filled with a huge number of videos where chiropractors, manual therapists, and bone setters crack spines, straighten people, and so on. But this is actually impossible. That is, if we take a video with an Indian doctor where he is straightening a child and the caption says scoliosis correction, we can notice that the child doesn't have a single sign of scoliotic deformity. What we see is called an acute shift. That is, the child's vertebra has shifted, there was a sudden muscle spasm, and what we see is a protective position of the spine in response to an acute problem. The chiropractor successfully set the bone, relieved the pain, and straightened out the child. But this has nothing to do with the treatment of scoliosis or with scoliosis in general. In other videos, we see chiropractors adjusting the curve, and this gives some visual effects. But the thing is, such a visual effect will literally last for half a day, maybe a few days. But after that, all the curves will return anyway, because all of this is supported by the muscles. And we can only influence the muscles through manipulation by relaxing them. Actually, the main thing is not relaxation, but on the contrary, specific strengthening of the muscles and correction of their position. Now, there are 2 main methods for scoliosis correction, the SIAS concept and the Schroth concept. And these are not some super difficult exercises. First of all, it involves selecting a corrective position, teaching the patient this position, special breathing into the area of the incorrect rib arch, and engaging the muscles. Not very intense, but very correct and asymmetrical. Because if we give symmetrical load to a patient with scoliosis, it will only lead to an increase in scoliosis, but not to its correction. That's why I'm often asked, but what about swimming? If we swim, will we be correcting scoliosis? Of course not. Swimming has never really cured anyone. It's just a fairly safe type of exercise. And what's most interesting is that professional swimmers very often, on the contrary, have a lot of scoliotic deformities. Because, for example, in the old school, they taught swimmers to breathe to one side when swimming freestyle. And when a child constantly breathes to one side, there will also be rotation of the vertebrae in the cervical and thoracic regions, and a descending scoliosis will develop. Many professional swimmers have scoliosis. That's why swimming and scoliosis treatment are absolutely 2 different things that should not be mixed together. That's why treating scoliosis in children is much more promising. It is usually done around 6 or 7 years old, when the child is already able to consciously do some exercises. For children, this can be combined with massage, osteopathy, and manual therapy, but that's not the main thing. The most important part is selecting the right exercises and performing special corrective exercises. And for adults, it's mainly exercise. And it's very important to check the difference in leg length and to balance the pelvis. If you're interested, I'll invite Olga Romanova. She will show you before and after photos of spinal correction using the Schroth method, and we will go over specific cases. I hope you don't have scoliosis, but if your friends suffer from this condition, share this video with them and treat scoliosis correctly. This was Dr. Emchenko with you. Goodbye, everyone.